With gratitude, the CLPNA acknowledges the traditional territories where we work and learn. The CLPNA regulates the practice of practical nursing on Treaty 6, 7, and 8 territories, the unceded territories, and the Métis homelands. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of what is now known as Canada, whose presence continues to enrich our community and whose ancestors have taken care of the land for centuries. Welcome to the College of Licensed Practical Nurses of Alberta's video on immunization practice and regulation. In this presentation, we will discuss immunization regulation, LPN scope of practice related to administering immunizations, education and reporting requirements, the maintenance of vaccine viability, also known as cold chain management, and considerations for LPNs who work for First Nations and Inuit health and programs outside of Alberta Health Services. The Health Professions Restricted Activity Regulation authorizes LPNs to administer immunizations to recipients 5 years of age or older in accordance with the standards of practice on restricted activities, advanced practice, and supervision. LPNs require the knowledge, skills, judgment, and competence related to the concepts and principles of immunity, communicable disease control, and immunization protocols. LPNs adhere to reporting requirements as defined under the Immunization Regulation. LPNs with previous education, training, or experience are not required to take further education and training, provided they are confident in their competence to perform immunization safely. For LPNs without previous immunization education or training, there are several options available. These include the CLPNA's online immunization learning module available through their MyCLPNA login, a continuing education program, or employer-supported education or training. Now let's turn our attention to the provincial legislation that relates to this area of LPN practice. The Government of Alberta Public Health Act aims to increase immunization rates, improve capacity to manage outbreaks in schools and communities, and improve the quality of immunization services. The Government of Alberta has additional reporting requirements, which we will discuss further on in this video. The CLPNA has developed the Immunization Regulation Duties Interpretive Document to assist LPNs in understanding their legal requirements under the Immunization Regulation. This includes assessments, reporting, and the storage, transport, and handling of vaccines. All healthcare practitioners, including LPNs, are required to report adverse events following immunization, also referred to as an APHE. It is important to note that even if the individual LPN did not administer the vaccine, any adverse event they are aware of must be reported. An APHE is an unfavorable health occurrence following immunization, which is not attributable to a pre-existing condition and that meets one or more of the following criteria. Is life-threatening, could result in permanent disability, requires hospitalization or urgent medical attention, is considered to be of a serious nature, is unusual or unexpected, or cannot be explained by anything in the client's medical history. Information on when and what to report involving an adverse event following immunization is outlined in the Alberta Health APHE policy for Alberta immunization providers. This policy is available on the Alberta Health website. The policy outlines specific reporting requirements for all health practitioners to follow. This includes the reporting of an adverse event following immunization to Alberta Health Services within 3 days of determining or being informed that a client has experienced an adverse event following immunization. Alberta Health Services manages all reporting of APHEs as part of the province-wide immunization program. Reporting of an APHE can be done online or by phone. There are several components to the APHE reporting requirements, including client identifiers, vaccine-specific information, and a description of the adverse event. It is important that LPNs are aware of the requirements and have the information readily available to ensure accurate reporting. All immunizations and immunization assessments are required to be reported electronically to Alberta Health within 7 days following the assessment or administration of the immunization. This reporting includes assessment with the intention of immunizing, client refusal of an immunization, any contraindication for immunization, and the reporting of past unreported immunizations. Additional information can be found in the Alberta Health Immunization Batch Data Submission and Response Guidelines available online. Immunization providers, including LPNs employed outside of Alberta Health Services, are required to report an adverse event following immunization through the central reporting line, as previously mentioned. The AHS province-wide immunization program has created the provincial APHI team who provide follow-up on reports received. Every report submitted by vaccine providers is important, as reporting supports the monitoring of vaccine safety. The provincial APHI team will also provide or recommend appropriate client follow-up. Please visit the Alberta Health Services website for further information. Now let's focus on storage and handling for maintaining vaccine viability. Vaccines require specific storage and handling and can become less effective or destroyed when exposed to temperatures outside the recommended range or due to inappropriate exposure to light. Storage and handling of vaccines, often referred to as cold chain management, involves quality assurance practices that maintain optimal temperature and light conditions during the transport, storage, and handling of vaccines. Each vaccine is unique and is required to be maintained as per the respective product monograph. More information on storage and handling of vaccines is available on the Health Canada website. In Alberta, the Alberta Vaccine Storage and Handling Policy for Provincially Funded Vaccine further outlines vaccine viability and cold chain practices and defines the roles and responsibilities for those involved in managing the storage and handling of publicly funded vaccines. LPNs working for First Nations and Inuit Health will continue to report APHIs and follow the vaccine cold chain policy and reporting pathways currently provided by the First Nations and Inuit Health Branch. Other immunization programs outside of AHS, such as occupational health and safety, clinic settings, or private institutions, are required to adhere to the immunization regulation described in this video. Additional information is outlined in the CLPNA Immunization Regulation Duties Interpretive Document. To learn more about immunization regulation, we encourage you to read the CLPNA Immunization Regulation Duties Interpretive Document, which is available in the Knowledge Hub. It includes direct links to documents such as the APHI policy, the Alberta Vaccine Storage and Handling Policy, and the Alberta Health Immunization Batch Data Submission and Response Guidelines. Healthcare providers have an essential role in gaining and maintaining public confidence in the safety of vaccines. This includes providing evidence-based information on the benefits and risks of vaccines, helping clients to interpret vaccine safety messages shared in the media or online, and identifying and reporting adverse events following immunization. Thank you for the interest you have taken in this important topic. Licensed practical nurses are regulated professionals who are committed to providing safe, effective, compassionate, and ethical care to members of the public. To do this, LPNs are required to consistently maintain and enhance their competence in nursing practice and be aware of strengths and areas in need of improvement. Please use the Ask CLPNA link on the CLPNA website to submit any questions you may have with regards to this video presentation.